Well, thank you, Brad, for setting me up. I mean, he, gave you the pre-hospital part of it, so I'm going to focus on what we do after we get the call. So first of all, I work at Montefiore ED. We have multiple sites. I work at the busiest site, which is the Moses site. We see over 100,000 patients a year. And we see a lot of stroke patients. Between all of our sites, we see 1,204 stroke patients, including stroke, TIA, hemorrhage, and subarachnoids. So our timeline for IV TPA is less than 3 hours, so you have to think about it. If the patient didn't call EMS for an hour, it took them another 45 minutes to get there. We have a very short window to deal with. There's certain patients will give it for TPA to within 4.5 hours, and then interventional is up to 8 hours. This was, I'm going to go back to that later if I can. Okay. So after we get the call from EMS, what do we have to do? Well, the first thing we can do is pre-registration. So if we get a call and they give us the patient's name and the date of birth, we can register the patient. And that's important because we really can't order a CAT scan, we can't order any lab tests until the patient's actually in our electronic systems. We have to set up so that the patient's evaluated by a clinician, so I'll get to that on the next slide, how we actually expedite that. We have to notify the neurologist, the radiologist, pharmacy. We have to get ready to do a CAT scan, and we have to make sure that the lab tests are done very quickly. So how do we do all of this? So as soon as we get the call from EMS, we go into our intranet, and on this intranet page here, we have buttons for certain emergencies, like if a STEMI button, a me heart button, a hypothermia button, and then there's a stroke button. So when we get the call, we go to the system, we click that stroke button, we put information in here about what hospital we're at, because there's multiple sites, the patient's name, the callback number, so they can call me directly on my cell phone. And then we give a little bit of a history. So we'll say 72-year-old came, EMS notification, left hemiparesis, estimated time of arrival 5 minutes. So we'll be very brief, and we'll send that stroke page out. Now that stroke page goes out to the stroke attendings and fellows, to the neurology resident on call, to our registrar, to the CT technician so they can get the table ready for the CAT scan, to the radiology PA, to the radiology resident on call. It even sends a page to the pharmacist so they can get ready to mix the TPA but not do it yet, and then to the lab so that they know they're going to be getting a sample from the ED. We also have what's called an order set in our system, so we can place all of the necessary orders, all with basically one click. So we go into our system, we click ED order set, and this sends all the necessary labs, which include the INR, the PT, include a page to the laboratory, so they're ready to get the specimen, and we order the CT scan. So these are really the key things that need to be ordered.